In this video, I'm going to compare vaccine-generated immunity to natural immunity to the COVID Delta variant. I'm Dr. Keith Moran. We now know more about the Delta strain of COVID-19. We know that the mRNA vaccines, Pfizer, Moderna, as well as AstraZeneca, J&J, they work well against the Delta variant, although you do need more antibodies to neutralize this virus compared to the other variants. Israel's health ministry estimated that the Pfizer vaccine was only 64% effective against the Delta variant, which is certainly out of keeping with other data from Europe and North America, where numbers are much higher than this. It's being reported that the Israelis' health ministry data even suggests that Israelis who have been vaccinated with Pfizer were about 6 times more likely to get infected with the Delta variant than those Israelis who had previously been naturally infected. If this is true, there may be reasons for this, but it certainly provides reassurance to those who have been naturally infected. There have been several studies which I've reported on previously in my video of truths of natural immunity. This is a recent study from Israel which shows that the protection after natural infection is similar to that of the Pfizer vaccine. This was done prior to significant spread of Delta in Israel. Here is the abstract conclusion supporting the data, which is based upon the entire Israeli population. As you can see, the level of protection from previous natural infection is 94.8%, protection for hospitalization is 94.1%, and protection against severe illness was 96.4%. This is not different than the vaccination data. This kind of research is important because it's important to know the level of protection in people with previous natural infection, particularly given the millions and millions of people who have been naturally infected, many who have been severely infected, and unfortunately some who have succumbed to the illness. You have to remember that with certain infections, natural immunity is better than vaccinated immunity. This recent study, posted July 14th, 2021, took a look at antibody levels to the spike protein in 3 different groups of people. The first group were unvaccinated people who had been hospitalized from March 2020 to May 2020, which they designated as natural infection 2020. The second group were unvaccinated, naturally infected COVID-19 patients who were hospitalized from April 2021 to May 2021, which they designated as natural infection 2021. Now, the third group were people who had been vaccinated previously with CoronaVac. This particular study looked at small numbers of people in each of these 3 groups that I've identified. Here is their slide. Now, there were 60 in the CoronaVac group, 30 in the natural infection 2020, and 30 in the natural infection 2021 group. In each group, they measured antibodies 15 to 22 days after full vaccination or after natural infection. This plot indicates the antibody level, specifically the IgG level, to an area of the receptor binding domain of the virus in each group. There is a range of antibody levels, but between each group there is no significant difference statistically. If you have a viral strain that requires a lot of antibodies to neutralize it, you will have a very low number of dilutions to accomplish this. This graph shows the 3 groups and compares the neutralization antibodies to each strain of the virus. WT stands for the wild type, which is the original strain from Wuhan, China. Now, getting back to the time and study, you can see that previous natural infection in 2020 and 2021 did better than the CoronaVac in this particular study. Again, you can see that the Delta virus had the lowest neutralization titers, no matter whether you had been vaccinated or naturally infected. Natural infection 2020 and natural infection 2021 did better than CoronaVac.